Selena Aglo here today at the Way to Healthy Living Center open house that is going from 10 a.m. to 2 p.m. And I am super excited to introduce to you Dr. Christina King. She's actually coming in to Suite 1 here on a part-time basis. Super excited because just as Dr. Christie of Still Medicine offers all kinds of options for individuals, Dr. King is going to offer something that is a little bit unique to many, but more importantly, non-surgical and non-pharmaceutical.
Yes.
So Dr. King, tell us a little bit about yourself and why you've decided to embark on this venture.
Yes. So for just my medical background, I did go to LECOM right here in Erie, Pennsylvania. And I did my residency in family medicine in Binghamton, New York in a dual accredited program. And then I spent the last 10 years doing family medicine here in Erie, Pennsylvania as well, and have seen a lot of chronic pain, as so many people do suffer with in this area and worldwide. And so just recently, this opportunity, I was approached with this opportunity to do the neurostimulation therapy, a non-invasive, non-surgical and non-medical, like you mentioned, device that we use to treat chronic pain of really any kind. And so I'm really excited to bring that to Erie. It's been on the other side of the state, but not available here. And I'm just really excited to help get people control of their pain.
And I am super excited that you have decided to bring it to Erie. Not only that, but to start here at the center. So tell us a little bit, if somebody is interested, right? How do they go about getting in touch with you, and what is the best way? And also, of course, the question is going to be, is insurance covering this treatment?
Right. So the best way to get in touch with us is through our website, NuCellRegen.com. So that's NuCellRegen.com. And on that website, you can click to read more about pain management. And on that page, there's a lot of information about the neurostimulation therapy that you can read about. And the second part of your question was, I'm sorry.
Most people say to me, well, does insurance cover that service, right?
Yes, thank you. So it is covered by most insurance companies if you have a diagnosis of chronic pain. And so chronic pain means that you have had that pain for at least 3 months. And that gets you qualified with the right amount of documentation with the doctor. So with most insurances, the exception currently is Medicaid, is a known exception. And obviously I'm hoping that will change over time. But a lot of the major insurances do cover it for chronic pain. It is effective for other diagnoses, but we need the chronic pain to get it covered.
Speaking of effective for other diagnoses, the interesting thing is some of the side effects are actually positive.
Yes.
What are those?
Yes. So the positive side effects are decreased anxiety, decreased depression symptoms, decreased PTSD, decreased symptoms with OCD. So a lot of mental health benefits for people. Even if it's not tied to pain. So some people have those symptoms because of their chronic pain, but it can help with those symptoms even when it's not tied in with chronic pain.
So it seems to me like it's a no-brainer. If I was interested and I've been dealing with chronic pain and I have some of these other, which is very common, Dr. King.
Absolutely.
I mean, very common. Then what can I expect when I come and see you? Because I know that, some people think about, like we were just talking about, battlefield acupuncture and maybe repeat visits and stuff. Can you share with us, like, what can I expect if I'm coming to see you? First treatment, first visit.
Yes. So the very first visit is a free consult on the phone. And we collect the information that we need and answer questions that people have and really explain everything in detail and individualize those answers to that person. And then once we get it approved through insurance, when we actually bring you into the office, it's a very small device that's placed behind the ear. It's a temporary device placed behind the ear, and it has 3 electrodes that come off of it and go on 3 specific points on the ear, similar to battlefield acupuncture, except that we leave those electrodes on for 10 to 12 days. And in doing so, it controls pain for 3 to 6 months at a time. It decreases significantly the pain for 3 to 6 months at a time. And because it lasts for that duration, insurance generally, when they cover it, will cover it for 2 to 4 times a year to keep that pain controlled. And with each subsequent, if you don't get full relief with the first treatment, each subsequent treatment will continue generally to further decrease your pain.
That is fantastic information. And again, we're super excited to have you here because we really look to provide as much quality resources we can to the Erie community with regards to better health. Dr. King, is there anything else you want to share with our audience today?
A couple of things. For those interested, this is a device that has been approved by the FDA as well as Medicare services. And also, we really want to make sure that we make this available for anyone suffering from chronic pain. So if you or a family member are homebound